Have you ever felt helpless when someone needed help? You probably have, and you are not alone. Our free first aid basics course equips you with the essential knowledge as well as practical skills to confidently handle emergencies. Welcome to this journey as we learn how to help save lives, all in under 15 minutes. Here is what we are going to cover in this beginner level short course. We will kick off with an introduction to first aid. From simple activities such as applying pressure to stop bleeding, we shall find out what exactly first aid entails. We shall take a look at how to manage an incident from step A to the last. In assessing the casualty, we check on the injured or ill person. Are they responsive? Are they breathing? Knowing these basic signs can help you determine the best course of action. Finally, we shall discuss the recovery position, an ideal position for unconscious but breathing victims. We'll walk you through this step by step so you can do it with confidence. Every second counts in an emergency. By learning basic first aid skills, you can be that hero who steps up and makes a difference. We have heard these two words before, several times. But what exactly do they mean? First aid refers to the immediate actions taken when someone suddenly becomes ill or injured, using the correct principles of treatment and locally available materials as they seek further medical help. This simply refers to whatever actions you take to help while looking for better assistance. Applying pressure to control bleeding, assisting someone to use their inhaler, and calling for an ambulance after a road crash are all examples of first aid. Let us define a few terms that we will be using throughout our modules. A first aider is someone who has been trained to provide initial medical assistance to a sick or injured person until professional medical help arrives. They are equipped with the knowledge and skills to perform basic life-saving interventions and stabilize a person's condition. We shall use the word casualty to refer to someone who is sick, injured, or in sudden need of medical attention. The initials EMS in this module refer to emergency medical services, or simply ambulances.
Having defined the common terms, why exactly do we give first aid? First, preserving life is a major aim of first aid. Ask anyone why they signed up for a first aid class, and the answer will probably be to save lives. Preventing further injury involves taking action to ensure the situation does not worsen. Promoting recovery is particularly helpful in medical emergencies like asthma. The use of an inhaler helps provide quick relief, thus promoting recovery. Lastly, emotional support is a crucial part of well-being. Talk to your casualty and reassure the family members and bystanders throughout the first aid process. In our second chapter, we discuss how to safely manage an incident, whether minor or major. Assessment is the first key step in incident management. Always ask yourself the following important questions. What has happened? What is currently happening? And if you do not intervene, what is likely to happen? Check if it is safe for you and others. Safety should always be a priority. Crowd control can be delegated to a few bystanders. Seek help if unable to do this on your own. You are the priority in safety, then the bystanders, and finally the casualty. Get rid of the danger if possible. It may be a simple measure such as turning off the ignition of the car, thereby reducing the risk of an explosion or fire. Put up a sign to warn approaching traffic. After assessing the situation and ensuring it is safe, you can proceed to give emergency help. This involves a series of checks which we are going to cover one by one. After assessing the scene, priority lies in assessing the casualty. This will help us know what to do next. Infection control is a priority in giving help. Your safety directly impacts your ability to care for your casualty. Whenever possible, wear clean gloves if you're going to come into contact with any fluid. You can also direct the ill or injured person what he can do himself if you do not have gloves. Remember to be careful when handling sharp objects, such as broken glass. If blood comes into contact with any wound on your skin or splashes into your eyes, nose, or mouth, wash thoroughly with clean water and soap as soon as possible. Seek medical help whenever in doubt. Use clean drinking water or boiled and cooled water if a person needs to drink. Determine if your casualty is conscious or not by checking the following. Check if they are alert by tapping on the shoulders or sole of the feet if your casualty is an infant. Call out to them to check if they respond to voice. Stimulate pain by pinching them or exerting a bit of pressure on their skin. If they do not respond to any of these, treat them as unconscious and get help immediately. Now, here is what you will be needing to know about your casualty. First off, are they conscious or not? Try calling out to them and stimulating them to try and wake them up. Call for help immediately the casualty is discovered to be unconscious and get started on the ABCs. A is the airway. Is it open? When unconscious, our muscles relax, and this includes the tongue, which might fall back and block the route through which air passes. Breathing is a priority and should be established immediately. Do this by bringing your ear next to the casualty's mouth to listen as you look and feel for the rise and fall of the chest. Do this for 5 to 10 seconds. If they are experiencing severe bleeding, stop the bleed. We take different approaches depending on whether our casualty is conscious or not. If conscious, try and find out what might be wrong by talking to them. Are they aggressive? Do they have signs of injury? Has this happened to them before? How are they feeling? Try to get all these information even from the bystanders around you. If they are unconscious or unresponsive, call for help immediately as you focus on the ABCs. Keep giving help as you seek advanced medical care. As mentioned earlier, when unconscious, muscles, including the tongue, relax. This blocks the airway and eventually makes it difficult to breathe. To prevent this, opening of the airway is taken as a priority for all casualties. Use the head tilt chin lift method to open the airway or use the jaw thrust technique if you suspect injuries to the head, neck, or the back. Check for breathing as soon as you open the casualty's airway. Look for rise and fall of the chest, listen to breathing sounds, and feel for the warmth of breath coming from the person's airway. If they are conscious but still breathing, turn them to the recovery position. The recovery position is a popular first aid skill, but why is it so important? Here are steps to placing someone in the recovery position. Remember, the key thing is to lay them on their side. Why exactly is the recovery position so important for breathing casualties who have lost consciousness? Here are a few benefits. It helps to maintain an open airway in the head tilt chin lift position. Lungs expand easily in the recovery position, and this makes breathing easier. Remember to place female casualties on their left side. What do you think is the reason for this? CPR, or cardiopulmonary resuscitation, is a set of life-saving skills that involves pushing hard and fast at the center of the chest to get the heart pumping blood again. Perform CPR for casualties who are unconscious and not breathing. Learn more about CPR in our basic life support module. First aid is only a temporary measure, and advanced help will definitely be needed in most cases. Getting medical help involves a series of actions, but most importantly, you need to have the designated emergency contacts in your area. Who are you? Where are you calling from? Why are you calling, and what type of assistance would you like? Engage in a conversation with the dispatcher and answer all their questions. As you hand over to the next level of care, certain actions need to be taken. Aftercare might include actions such as seeking counseling services, clearing the accident scene, contacting relatives if necessary, and restocking your first aid kit.
In summary, we can use this mnemonic to help us remember the steps to follow in an emergency. A. Assess the situation. M. Make the area safe. E. Emergency help. G. Get additional help. And A. Aftercare.
An emergency care should not be given on a first-come, first-served basis, but according to priority. This sorting is referred to as triage. In a multiple casualty incident, the first aid provider should assess the ill or injured before providing care and provide care first to those people with the most life-threatening conditions relating to breathing and circulation.
Phones are commonly used by bystanders to film emergency incidents. Filming an emergency incident is inappropriate. particularly if it blocks the path of a first aider or professional responder. First aid providers and educators should raise awareness of this.
You are almost done with this course. Just one question. What is your local emergency contact? That is your challenge for the day. Find out and have it ready in case of an emergency.
And that is it for this short beginner's course to first aid. We hope you enjoyed learning with us. Check out our other courses and get certified today at www.thequickfix.org.